I love what I do, but this presentation is going to be boring compared to the previous panel, which was really great. So I'll do my best. I think this sort of, I'm going to say a lot of what we've talked about before, but you know, look at what was going on 40, 50, 60, I don't know when this was done, years ago. People can change, and professionals can change, and societal values and societal norms can change. So this is what we're trying to do. We're trying to move from there, where we are probably now in terms of prenatal or pediatric environmental health, to a new dimension. And we've been talking about how to do that. Environmental health is a really complex study. It's multidisciplinary, transdisciplinary, whatever you want to call it. You know, a lot of people here will be left out of all those little boxes I threw together. But it's really complex. And it's part of the problem of environmental health, certainly with academia, is where do you sit? If you sit between, if you're spanning, where do you find your home base? Are you a geographer? It seems to be a place where environmental health people stay. But certainly in medicine, environmental health is a hard place to perch. And I think that's one of the problems. So it's a difficult science in that it's multidisciplinary. It's difficult in many other ways, though. It's the exposures are upstream, so in terms of our profession, when people present to emergency rooms or family doctors, the exposure is upstream. It might be 30 years previous, and patients aren't aware of it. It's complex chemistry. It's not what, certainly in terms of the physician mind, what we used to with, well, that infection caused this, or that cholesterol level caused this. It's more complex, more difficult to define. It's also, one of the difficulties is the battle with industry that Bruce talked about, that each forward step is a major battle, and you know, with the vested interests. I think that's a very important issue. And so it's something difficult to grab onto, and what we have to do is get our messages clear and simple. It's difficult to teach, though, and I was talking with Fiona earlier. Fiona teaches nursing, and she said, I'm going to quote her, she said, I found a way to infiltrate environmental health into my teaching. And I wonder how many of us do that. We find a way to infiltrate environmental health into what we want to do and what we need to do. So it's difficult. It's also, what's the definition? Today we've been talking a lot about toxics and toxicology and exposures to toxicants, but environmental health is also urban design, and we're going to talk about that later. It's climate change. It's many issues. It's huge. A friend of mine who's a geneticist says everything that's not genetics is environment. So go figure. And the last thing I want to say about the difficulty of environmental health is this issue of it's politically dependent. The policy is very political, the funding is very political, and so it's almost a cyclical thing. And certainly we hope, well, I'm a government employee, but still, we hope that with a change in government that we'll see more emphasis on this. And Ontario just had a change in government, and our new Ministry of Environment is now called the Ministry of Environment and Climate Change. So I'm going to talk a little bit about my work with Health Canada. We work with an index called the Air Quality Health Index. So it's an index that the idea is to feed to people their health risk from the mix of air pollutants in the environment. And so it's a way that, like the UV index, people can grab onto and say, at that number, I am affected. If I'm an asthmatic and I'm out riding my bicycle and it's the AQHI is 6, I shouldn't be doing that because I'm going to start wheezing. It's going to make my asthma worse. So how are we marketing this? What are we doing in terms of education? I'm not talking about education within an institution. I'm talking about the audience is people, the public. But there are two audiences. There's the general public, and then we have a special audience that's vulnerable people with respiratory disease, people with cardiovascular disease, seniors, children, perhaps pregnant women. So they're more targeted. So social marketing. We have this nice index. It's on the Weather Network. We're pushing it in newspapers, et cetera, et cetera. So full-on social marketing. Probably going to be in a drugstore near you or some sort of corporate environment where you can get a tear-off from your pharmacist, which is a way to reach vulnerable people. We also have public health outreach. We have public health creating literature, going into schools, going into daycares, going to senior institutions. That's the other way we're reaching out, educating. And the third way is trying to reach vulnerable populations through healthcare professionals. And let me show you this interesting slide. I think this is quite important. This is the only study that I've seen of this kind. It was a study looking at moderate asthmatics and saying, what we know about asthmatics is that when the air quality health index goes up higher, they should restrict their exercise. So there should be a behavior change. Because the more exposure, more you're outdoors, the more you're exercising, the more exposure, the more likely you are to get sick. So how much did asthmatics change their behavior, outdoor activity, from media alerts? And you can see the bottom number, 23%, if they hadn't received professional advice just from the media alerts, from the social marketing, 23% of them changed behavior. If they got a short message from the healthcare professional, 57% of them changed behavior. And I think that's really important. I think there are many layers to what we do. There are many layers of communication and education. And I think, I don't know if other studies will have shown this, but I think that it's a very interesting study and really talks about what a lot of us here are multidisciplinary health professionals, what we're doing. So in our outreach with trying to reach vulnerable patients, we have a group that's called Train the Trainers, and there's a few of us here. And it's great to see a few of us here. But it's a multidisciplinary group. We're trying to reach respiratory patients. Well, we have pediatricians, we have family physicians, we have respirologists, we have nurses, we have respiratory therapists. Recently, one of the greatest at-risk groups is cardiovascular patients. And we ran into this barrier whereby sorry, I don't have that slide. Whereby it's very clear that cardiologists and cardiac rehab specialists do not understand and are not aware of this link between the environment and health. In fact, the Heart and Stroke Foundation did a study in Canada that found that 13% of heart and stroke patients had been told that there's some link between heat and air pollution and your disease. So it's a very, it's much more intuitive to think that there's a link with respiratory disease. So how did we went about that by interesting some cardiac rehab professionals, because they see the vulnerable patients, and they're starting to create position statements on this relationship and starting to introduce it into the literature and into the education. So a very hard nut to crack. Cardiologists, we sort of took a roundabout way and went to cardiac rehab, where there's tremendous contact with patients, and hopefully we'll be successful at that. At least we're making some movement. So how difficult is this? You know, this is the Canadian guidelines for asthma. It's the one area where environment is talked about. This has been in place since 2009. This continuum for asthma was introduced. And there's a section on air pollution. Yay, we did it. But it makes sense that respiratory air pollution is linked. So much more difficult to get into cardiology. Even more difficult, I think, to get into prenatal, although I am really thrilled that midwives are here today, that the Society of Obstetrics and Gynecology is introducing, that pediatricians are here today. I think that's really, really, really important. I think the fact that respiratory, that link is understood, we need to make those other links much more obvious. So my last slide, and I'm trying to go 5, is just toward this idea of knowledge translation. We need to take this research, take this knowledge, put it into action. We've got Erica, who's going to talk about what I think is a fabulous example of doing this. The CPCHE example is fabulous. We really need to define our audiences, and I completely agree that policymakers are a very important audience. Politicians, managers in healthcare institutions are a very important audience. So there's many layers to the audience, and we need to tailor our message to them. There are lots of barriers. There's people are busy, the agenda's full, the political climate is not conducive right now. But what's really exciting is I think Eric's to be congratulated for bringing us together. I think putting the extra pieces in, bringing the other professions together is a very exciting piece. And as educators, it's very exciting what the next generation's doing. I taught an undergrad course in environment and health at U of T for 12 years. Early on, I had 16 to 18 students. When I finished the course, there were 120 and more wanting to get in. The next generation is very keen, understands the link much better than we did, doesn't really like the silos that they're being educated in. I think there's great hope for the future. Thank you.
Last night when I was reading to my son, I started to lose my voice, so I'm hoping that the copious amounts of water I've been drinking today will push me through this. So excuse me if my voice cracks at all. Thanks to Eric for inviting me to come speak today. So just to give a little bit more background, I'm coming from the perspective of the government program. So I am a stakeholder engagement and I work in stakeholder engagement and outreach for the Government of Canada's Chemicals Management Plan. So I'm here just to give a little bit of background on our efforts to educate the public on potential risks and safe use of chemicals. So a little bit of background, I'm not going to go into much detail, but the Chemicals Management Plan was launched in 2006 when the Government of Canada completed a triage of 23,000 chemicals that had been in commercial use during the previous 2 decades. And so it's not looking at the new substances, but those that were already in commerce. And the triage process identified 4,300 substances that required further attention. And the goal of the Chemicals Management Plan, here on out referred to as the CMP, is to address all of these 4,300 substances by 2020. What does the CMP do? It does all of those, but I'm not going to focus on the majority of them, except to the bottom. I want to flag that the CMP does provide enhanced stakeholder engagement and outreach to Canadians. And our outreach is the general population. The Chemicals Management Plan does not look at occupational or workplace health. That is looked at in other branches of Health Canada. So the issue for today is, despite a considerable profile of the CMP in the international community and among many NGOs and chemical industry, the general Canadian public isn't very aware of the work that we're doing. And this is of particular interest to my office because we've heard from our stakeholders with whom we've been working from the beginning of the CMP that Canadians want more information on chemicals, in particular how they impact their health and on actions they can take to minimize exposures. And it had been previously flagged, public outreach, as something that we needed to improve, and so now we have an extensive strategy in place, but it's continuing to evolve as we get more feedback from our stakeholders and the public, and of course trying to keep up with the continually evolving media. So our current approach, we use a slew of tools to outreach to the public, websites including the Chemical Substances website and more general Healthy Canadians. We have a number of publications. We use social media. And with social media, we're looking to create some plain language content on specific chemicals or groups of chemicals and proactively promote the assessments and the risk management decisions that are being taken under the program. There's also attendance at trade shows and marketing activities, but we're also looking to increase our reach of marketing activities through strategic partnerships with NGOs, healthcare organizations, provinces and territories, etc. Just to give pictorial examples of some of the work we've done, the Hazard Check Guide, I'm sure many of you are familiar with that. And just a few weeks ago, we published a seniors environmental health guide I know it's a group at the other end of the spectrum from which we're talking about today, but another vulnerable population that I'm sure some of you do have some interest in. And we also have some fact sheets and some more interactive tools available to the public. But what do we know? What have we heard? We know that Canadians themselves have a role to play in protecting their health because chemicals in products they use every day are a key source of exposure. And in fact, Health Canada sponsored a 2009 study which was conducted by the Canadian Medical Association on research in environmental health. And two main findings that impacted our work were that Health Canada and the Public Health Agency of Canada are considered the key sources of information to share with patients, and that Health Canada should do more work directly linking in with the health professional associations. So to date we have begun to do a number of collaborative work with health professional groups, such as sending out some of our publications directly to physicians' offices. We have regional staff that deliver chemicals learning modules to nursing groups. And we also have a number of representatives from various national health professional associations that are engaged in ongoing stakeholder meetings and workshops, such as Canadian Pediatric Society, Canadian Institute of Child Health, etc. So the directions that we want to take for improving public health outreach, public outreach is one is to increase the proactive communication to the public on chemicals. So we want to make the findings from the Chemical Management Plan relevant to Canadians at the household level. And secondly, use partnerships to expand the reach of messaging and seek efficiencies. And that's where you in attendance today can hopefully help us out. And I'm going to end actually with some questions for you, the audience, some things to ponder, maybe take some notes and think about, and perhaps give some of your thoughts during the discussion following Erica's presentation. So stakeholder engagement and support is a strength of the program, but how can we work more closely with health professionals, which is a key stakeholder in order to improve our education of the public, knowing the value and the trust, as Eric mentioned at the beginning of the session this morning, that patients, particularly pregnant women, put in their healthcare providers. What are key considerations and components in messages to the public? And one thing, it's not up there, but what kinds of questions are your patients asking you as pregnant women coming to see midwives, nurses, obstetricians? What are the questions they are asking you about environment and health, chemicals and health? So just some things for you to think about, and looking forward to the discussion after. Thank you very much.
Good afternoon, everyone, and thanks, Eric. This is an amazing event, and I'm really glad that everybody's here and that we've had a chance to pull together the first time that this topic's been addressed in Canada in this type of forum. So really great to be here. I had a little slide introducing CPCHE, but I think I can save some of my 5 minutes by skipping right over that. I think people in the room have a sense of who we are, but I do specifically want to acknowledge that it is truly a partnership. We have 10 partners that have been working together for more than a decade, and more recently affiliates, Center for Environmental Health Equity, Jeff, other affiliates in the room. So lots of CPCHE folks in the room, and of course want to acknowledge the role of our very strong partners in what we do. So I was inspired by our academic setting here to give you guys a quiz. So what do these two things have in common? We've got a baby bottle, a plastic one, and Thomas the Tank Engine. Yeah, good guesses, but you know what it is? These are two of the items that started to shift our assumptions as Canadians, that the products that we buy on the shelf are of course safe because somebody's checked them out. I think this was the bisphenol A in the baby bottles, and I don't know if you recall the contaminated Thomas the Tank Engine high-end toys, I might add, having purchased several of them for my son, with lead-contaminated paint on them. So massive recall of Thomas the Tank Engine, among other toys. So these were sort of iconic, changing perceptions of parents and others that just because you can buy it doesn't necessarily mean that it's safe. So we've got a product for babies and products for toys, starting to see that, to bring about that change in perceptions. And I feel like even in my time with CPCHE, I've seen that change start to happen in those sorts of responses you get from parents and service providers. That assumption, that complacency or trust is starting to change. So growing public awareness that everyday products and exposures related to those products may not be safe, that things haven't always been checked out in advance, as Bruce, of course, very well explained this morning. Other aspects of the changing landscape with respect to toxic exposures and health: parental concern and parental action. People are more familiar with some of these things. They're hearing about them. They want to know. They're asking more questions, and they're trying to make choices and actions where they can. Probably no better way to show that this is the case than the fact that industry is responding. They know very well they're consumers, and they do the research, and they know that consumers, and well, also known as people, care about toxics. So they're starting to respond. We have Walmart asking its suppliers to get rid of certain toxic chemicals in the products that they purchase. Huge potential there to change product streams. Procter & Gamble, there have been a number of notable changes. You know, it's marketing potential, but it is change. So emblematic of that shift, that people are wanting products to be safer. And as Bruce mentioned, we're also in the midst of a shift. It's no longer just, you know, diseases that are, you know, not chronic diseases, the infectious diseases and cancer. We're talking about other sorts of health outcomes, some of which don't even get the term disease put them. Impacts on the brain, they're not considered a disease, but it is an issue. Those are health effects that lots and lots of families are dealing with. So those new childhood morbidities. And then fifth on the list, I put it in gray because it's not actually reality yet, but certainly on the wish list, is that our strategies for prevention are also hopefully going to start to change, where we start to see reduction in environmental toxin exposures as a core part, a contributing part of strategies to reduce lifetime risk for various chronic diseases, and also to promote neurological health, to start getting at some of those brain effects that we were discussing this morning. So one of the things that CPCHE has been doing over the past few years to try to respond to that changing landscape is to respond to the interest of parents to know, you know, what is it I can do. So, of course, drawing upon years of work, distilling evidence and so forth, the expertise within the CPCHE partners and lots of other folks. I put up a couple of resources there at the bottom, the CPCHE primer, obviously a base of a lot of the outreach work that we do, and also more recently through a multi-year collaboration that CPCHE had with a network of chronic disease prevention groups. A couple of the CPCHE partners produced this report on the links between early exposures and lifetime risk for various major chronic diseases. So really looking at the evidence, but then stepping back and saying, what is it that parents and others need? What do they want? What can they use? So that was the groundwork for what we call the top 5 tips. You see them here, and very deliberately Bust That Dust is at the top of the list because a lot of the chemicals from the products that we use on a day-to-day basis, they settle into the dust. And guess who's down there on the ground putting just about everything into their mouths? It's our kids who are more highly exposed. Go green when you clean, renovate right. Lots of people have that nesting instinct and want to paint the room, and you know, you have expectant couples, pregnant moms doing renovations, really the worst time to do that. So it's really trying to focus on some of those issues. Get drastic with plastic. Issues about BPA, not microwaving and plastic, etc., and then the mercury in fish, dish safer fish. We've got a suite of resources, and Eric's given me permission to go way beyond my 5-minute allocation. So we're going to see a little bit of the video, but we've got a brochure which is actually available in 7 languages online. the video, and then some tip cards, which are the resources that prenatal educators and others can use to incorporate some of these tips into their work. And then the blue button there you'll find on our website, resources for professionals. So things like sample curriculum, ideas about grab bag activities, hands-on activities that you can do with parents in a group setting or one-on-one to help, put this into practice a bit. CPCHE's approach to doing outreach is not to try to knock on every door in Canada, but rather to engage with the people who do interact with parents on a day-to-day basis. So the whole impetus was to build together with service providers a tool that they could integrate into prenatal health education in particular, but also obviously other potential uses to work with prospective and new parents on what can be done on an individual basis to reduce exposures. Some of the things we learned from doing this, CPCHE, like many groups, used to have a very sort of pedantic approach. We wanted to talk about, we know about BPA, we know about phthalates, let's write about that, and organizing it chemical by chemical or health effect by health effect. That's not what people want. People are busy. They just say, okay, don't tell me all about the chemicals. Just tell me what I should do, what I could buy, what change can I make. So very much trying to respond to that. Service providers, involve them. We developed the video arm in arm with a number of frontline service providers, some of whom are in this room, really to create the tool that they would want to use. And the response has been amazing. I mean, the video, we haven't been able to do a sort of a formal evaluation, but anecdotally, there are people using it on Facebook. We heard this morning Linda is using it in her FASD prevention, making that link between alcohol as a toxicant and other sorts of toxicants. There's one public health unit that's considering building it into their prenatal app. All kinds of really innovative uses. So if the messages work and the medium works, people will find ways to integrate it, or perhaps we use the word infiltrate those key messages into their routine practice with families and parents. Content, really important, striking the balance between the important and the practical. There may be really important things that aren't practical to address on an individual level. You don't want to frustrate people, but at the same time, really give them things that they can do, that are within the scope of their control. And finally, this one I think is really important. Knowledge is empowering. We may have a tendency to say, parents, particularly those in disadvantaged circumstances or struggling with poverty, they don't need another thing to worry about. But I actually personally believe, two things. One, everybody has a right to know. It doesn't matter who you are, you have a right to know that there are toxic chemicals in your homes and your products, and that there are some ways, including political engagement, to make that change. But also, parents want to do the right thing for their kids, and if they're hearing about this and they don't know what to do, that is not empowering. We did have a chance, and with Jill and Karen, to do focus groups with the top 5, sort of a pilot test, showing the video with mostly new immigrant moms in disadvantaged neighborhoods in downtown Toronto. And the response was amazing. They loved it. They wanted to know what they could do because they wanted to be good moms, right? Just like we all do. So I think that while it's certainly true that not everybody can action everything, people still have a right to that information, and knowledge is empowering. And even if it's small steps, it's affirming for a mom or a dad to be able to make even those small changes and feel like they're making at least some difference. So I'm going to show the video, but because I always forget to show the acknowledgement slides, I'm going to put it up now. So of course, CPCHE partners, the members of the Top 5 Tips Steering Committee. I see Joanne's in the audience. Lots of folks worked very, very hard on that. The Government of Ontario actually funded the initiative. Today's Parent helped us put together the brochure, and most especially Mariah Burton, who was the brilliant young artist who created the video that you're about to see.